All right, in our continuation of our pregnancy video series, we're at the point with one of our pregnant patients where they're 39 and a half weeks before we're at our due date. And as you know, typically any time after 38 weeks, the baby can be born safely without any concern. So, as you can imagine, a lot of our pregnant women start to get antsy. That's 37, 38 weeks, 39 weeks, because the 9 months has been a long time to be carrying this baby. And they just let's get this thing going here. So chiropractic has techniques that sort of improve nerve function to the point that we can encourage labor to begin. So our main technique that we like to do is a tonal technique, where we're working on the cranial sacral area. Now you have a cranial sacral pump that sends the cerebrospinal fluid from the top all the way down to the bottom and bottom to the top. So what we like to do is just relax all that area in between here and allow that fluid to flow, and that has a tonal effect on the nervous system, which then can allow the body to function at an optimal level, which then in turn make circumstances easier for labor to begin. And a lot of times we can get that process started. And the same goes for when we get past the due date. I'll have a lot of pregnant women come in and say, hey, I haven't had my baby yet and I'm 40 weeks, and then they'll just start coming in every day, and we'll just encourage that process. So the first thing we're going to do is we're going to take our arthrostim instrument and we're going to apply a light repetitive tap at the base of the occiput here, just like that. Very light vibrational tap. You may think it might be annoying to have that beating on your head, but it's not so much annoying, and it's relaxing that muscle tissue there and stimulating the flow of the cerebrospinal fluid right beneath the brainstem area there. So we just do this for a little bit, and then we'll change our location from the suboccipital area down to the sacrum. And the sacrum is real important in pregnancy because there's a huge plexus of nerves that come out of here. A plexus means a group, a big grouping of nerves. And by just tapping over the sacral tubercles, again, we're relaxing that whole area and we're stimulating the flow of things. Now, interestingly enough, the sacrum, the name of it, it's a triangular bone that sits between your pelvis and then has your tailbone at the end. The sacrum is named sacrum because it comes from the word sacred, because that's how important it is in actually overall health, with all the nerves and all the junctions that connect to the spinal cord there. And that was discovered eons ago. And it sort of is probably one of the most neglected areas in health today. And that's why the cranial sacral therapy is very popular. So that's the fan on my arthrostim. So once we stimulate that, then what we do is we take our thumb right on that same spot, and my thumb right on this spot at the suboccipital area, and we just apply a steady, constant pressure. Now, typically, I wouldn't be talking while we do this, and it would be, relaxing for our pregnant patient who will be laying there and just sort of enjoying it and relaxing. But I'm probably talking and messing up the relaxing. Well, we do this usually for about 30 or 40 seconds. And one of the responses we can see as we're doing this is we could just watch their whole body calm down. And you can see their respiration rate change, and you just watch it. You can see how the rib cage is moving in and out, and then all of a sudden everything just starts to slow down. So it's a very calming technique. that's about that. So then once we do that, then we're able to move into our normal adjustment. So we'll get these areas up here, and then we'll do our drop technique on the pelvis. And then balance the sacroiliac joints out. What we'll do next is we'll just proceed to do everything else we do in our pregnancy adjustments. We'll flip the patient over, and then we'll work on the round ligaments. We'll work on the anterior pelvic bones, the pubic bones. We'll work on the neck to clear out tension there, and then we'll work on this lordotic curve area where the belly's been pulling so long. So that is the adjustment we do to help bring labor along. As I said, it's a tonal adjustment that basically works with the cranial sacral areas. All right?